And thanks for staying with us on Hello Malaysia. We are talking about commercialization of biotechnology in the Malaysian perspective. And we were talking about the coordination of certain agencies and also parties in order to make biotech in this country more successful. We had Prof to comment earlier as well on the commercialization of biotechnology, and Dr. Nabisar, who explained at length some of the problems that we are facing in order to commercialize biotechnology for certain products that are being done and also researched on. Now, perhaps Dr. Nabisar, you'd like to continue by talking about the importance of the coordination of all these different agencies.
Yeah, okay. Yeah, it's very important because the university is producing very good science, okay, and they're very good at it. So what we need to do is to help it to hit the market. To hit the market, we need to do Ministry of Science earlier on have introduced pre-commercialization fund, because in Malaysia we don't have, it's very hard to get the funding. So we had this pre-commercialization fund. So in there we try to transfer the technology from the university to, for more going towards creating value, creating business. Then from there we go from pre-commercialization, where the way you do your research, the way you try to upscale it will be slightly different. Then you go to the commercialization stage.
Is there sufficient funds for this?
There is a bit, yeah.
Okay, yeah. How much is that?
Under the RM9, there's about 1.2 billion under Techno Fund, and Techno Fund is supposed to assist in transfer, in helping from the lab stage research to pre-commercialization. So
there's actually no excuse to transfer what you actually achieve at the lab into commercialized stage. Is there, Prof?
No excuse.
Yeah.
We can do it. It's just that we don't. Again, I say, we lack manpower. For instance, I do have funds for pre-commercialization of my product, but I'm also teaching. I'm also doing so many other things. So if we can have more people, and one of the ways is actually to have internship programs in our with our undergraduates as well as postgraduates, where they can spend at least 6 months with the industry, so that they become interested in commercializing our research products. Most of our students will be doing final year projects, and postgraduates will be doing their various theses on various parts of biotech. So we can actually bring those for commercialization. But we need somebody to sort of hold the whip and say, come on, let's get it done,
Right, so what we have now are people who are expert in that field, academicians mainly, but they don't, probably not business minded enough.
They need a bit of assistance. Yeah, so this assistance should be coming from, from one of the agency that government has formed.
Which agency is that, Dr.
Biotechnology Corporation, or one of those,
MTDC.
Yeah, MTDC, they should come into the picture, try to assist, and they're already helping, but it's just because of funding and then lack of manpower, skills in commercializing, because when you are trying to create a business, you need to have the skill set, and there are not that many people that we have currently, especially in the technology area.
Right. What is involved in commercializing biotechnology? I mean, do you have to go through the normal run-of-the-mill thing, the marketing, the sales and distribution, the channels, and all that? How's that?
The first thing that you need to do is first identify the technology. This technology, you can bring it forward into commercialization, and then once you got the technology right, then you want to set up the whole operation, and then you want to look at your whether you have the margin, if you can produce. Sometimes the technology that you use in the laboratory, you cannot commercialize, because when you're upscaling, because it's become too costly, and sometimes it doesn't produce what you need. Let's say a bacteria in the bioreactor could produce what you want, a very valuable product, but when you go big scale, maybe a bigger fermenter is not going to produce what you want, or maybe the yield is very less. So there's a lot of factor that you need to look at. So we need experts in, or people who have experience in commercializing business in technology area, to be able to see this area, see the problems and guide these researchers or small companies to go big.
Right. Prof,
Yeah.
what do you think?
But apart from having a good business plan, you know, I think you have to get the right partners as well. Partners who are willing to take a risk, because biotech is a risk. You know, as what Dr. Nabisar said, you know, you do experiments in small amounts. Let's say in this cup, for instance, it's a small amount. So all the results are there in small amounts. And now you want to commercialize it, you want to expand to a huge 2-story fermenter, you know, it's totally different.
Yeah.
So
The result
everything else
may
is
not
different.
may not be just like how you
No,
wanted it to be.
not in a coffee cup.
You're right.
You see, so there is a lot of investment there, because when you do experiments in large amounts, it costs a lot.
What about patenting of all this research and discovery and all that?
It's good to
Patenting.
patent.
Yeah, that's
but at
important.
some
It's
time,
vital.
it's not mandatory in all the cases you want to patent, because some of it you want to leave it a trade secret. And because we are in this part of the world, and it's a lengthy process, patenting is a lengthy process.
But isn't it vital to patent so that it's not stolen and used by somebody else?
It depends. You can patent something if you feel that it's worth it, that you can actually sell. Somebody's going to buy your patent, but then you wouldn't want to patent something that people can copy. They can reverse engineer and get what your secrets are.
Yeah.
And in fact, when you patent, you have actually to declare everything in your patent in the files, you see. So everybody will know what you're doing. So you may want to be to make it a trade secret, where you can make more money.
Right, so it's not exactly the most
Yeah.
vital thing
No,
that,
it's
that you need to do. But if you talk about obtaining this technology, whatever technology that we have derived, is that more locally that you have obtained it, or from overseas?
We could both, because under RM7 and 8, a lot of money has been pumped for research, especially into agriculture and looking at herbicide resistance and also improving the crop yield and all that. So we could use that, because at the moment the research is done, but many of it hasn't reached the commercialization stage or even the pre-commercialization stage.
That
So
was
somebody
since-
have to look at it and say,
Right.
look, you know, there's a potential here, and we should look at it and then try to do something about
That
it.
was
you
in
know?
the 7th and 8th Malaysia plan.
7th and 8th
What about
Malaysian
the 9th
plan?
Malaysia plan then?
The 9th Malaysian plan.
Prof? Yeah.
Yeah,
Yeah,
Prof.
we have a few things that we have commercialized, and there are now even using molecules from oil, you know, from the palm oil. You can actually have lipids that you can use for cosmetics now. So there have been funds released for commercializing those products.
So how far is Malaysia actually in terms of, if we compare ourselves to the region or even globally, I mean, how far have we reached in biotechnology so far, after all the emphasis that's given by the government and also the relevant agencies, Doctor?
I think we got very good policy, yes, but I think we need to improve in our implementation. Yeah.
And these policies would be, is there a lot of policies in...
Well, we have the biotech policy.
Yeah.
Okay.
It
Which
was
got, yeah.
in 2005.
Yeah, 2005, yeah. And we got 9 trusts into it, and the first one is, you know, trying to have more agriculture biotechnology, you know, development of products through agriculture biotechnology, and the second trust is about health, and the third one into manufacturing, and you know, so forth. We have 9. Yeah, we have very good policy, and I think it's about time that we go into implementation of the policies.
Yeah, and you were also saying that there's a problem of implementation. How is that?
I think wouldn't see it as a problem. I think it's more to do that we are lacking the skill set in trying to commercialize a lot of stuff. You know, we lack the skill set, and then also the funding, and also the infrastructure, you know, that bit of it. But for the research side, we have very good infrastructure, except, you know, like Prof was saying earlier on, like equipment, when they're spoiled, you know, you have to wait a long time, you know.
You've waited for months for these equipment.
You know, until everything is just sort of cooled down, you know, when your excitement is just gone. Yeah, but we can actually do more, and I think what we can do is actually we can work our way out of the problems that we have. And see how we can move forward. One of the ways is actually to try and reduce the, working on abroad, like Dr. Nabisar said, we should be more focused to what we are doing. And maybe we can share our facilities with others. That's another way of, because we shouldn't build empires for ourselves, but actually what very expensive equipment we should share.
That's sharing with, we're talking about
various scientists, or we can lease out to various companies. Why do we, when I was in UK during my postdoc, we had biotech companies working in the labs, in the universities. And so we get part of what they're discovering and selling as for cheap, but they get to use the university equipment to produce something that they want to try out for commercialization.
What are all these problems like taken into account and looked into before starting out on something like this whole wide range of biotechnology research and all that, Doctor? All these problems like taken into account, like the problems of implementation and the role of various agencies and all that. Wasn't this all taken into account before we started out? The government actually started out on something as vast as biotechnology.
I think by hindsight we can say a lot of things, but it is quite difficult because it's a challenge when they started off in the 80s. Yeah, so I think at that time there's in the best possible way they have addressed what needs to be done, but later, because biotechnology is very competitive and a lot of things start changing, and so it's just coping with at a global level